This PowerPoint prepares you with the subsequent medical treatment for in vitro fertilization and pre-implantation genetic testing, Ivf Pgt in short, in Queen Mary Hospital of the University of Hong Kong. In Queen Mary Hospital, we work as a team. The team provides you with ultrasound examination, egg collection, and embryo transfer. These procedures are supervised or performed by subspecialists in reproductive medicine according to their duty rosters. In this PowerPoint, we would like to go through the following contents: the indication, procedures, the genetic tests we have performed, limitations of PGT, prenatal diagnosis, the timeline of Ivf Pgt, the charges in our hospital, and subsequently we welcome all the questions. So first of all, the indications. Pgt can determine the genetic makeup of embryos before they are transferred to the womb in IVF cycles. This allows the selection and transfer of embryos unaffected by the genetic disease, which the fetus is at risk for. Before the start of any Ivf Pgt procedures, a detailed genetic report is needed. These are the subclassifications of Pgt, which includes the Pgt-M for monogenic or single gene defects, Pgt-SR for structural rearrangements such as translocations, inversions, Pgt-A, aneuploidy screening in advanced age, recurrent pregnancy loss, or repeated implantation failure. So these are the genetic diseases our center has performed so far, which includes 85 diseases. Genetic diseases out of this list can also be considered depending on the genetic changes and its implication on individual patients. All patients will be assessed individually for the suitability of Pgt. So for the procedure of Pgt, it involves Ivf procedure. So we'll go through the Ivf procedure first. So the Ivf procedure involves the stimulation of the ovaries, subsequent egg collection, fertilization of eggs by intracytoplasmic sperm injection, extended culture and biopsy of cells from blastocysts, genetic test, and then subsequently embryo transfer. Traditionally, there are two types of insemination methods with IVF. First, conventional insemination are used for sperms which allowed to fertilize the egg naturally within the culture medium. Secondly, we have the intracytoplasmic sperm injection, which is termed ICSI, where a single sperm is injected to an egg. Overall, the quoted fertilization rate of eggs would be around 60 to 70%. ICSI is usually performed when there are severe male factor infertility. However, it is also required in PGT cycles when semen parameters are normal. This is to avoid sperm binding on the surface of the eggs, which may interfere with the result of the genetic test later. After fertilization, the embryos will go on to cleavage stage on day 2 and day 3. Subsequently, we'll further culture it to day 5 and day 6, where it becomes a blastocyst. In blastocysts, they are mainly separated into two parts, the outer trophectoderm layer and the inner cell mass. When an embryo reaches the blastocyst stage, where there would be around 200 to 300 trophectoderm cells. Our embryologist will remove around 5 cells from each blastocyst for genetic testings, according to the need of individual patients. Blastocysts will be frozen individually following the removal of around 5 trophectoderm cells from the blastocyst. The genetic report will be available after 2 weeks, and then subsequently will arrange frozen embryo transfer when there are genetically normal blastocysts. Current genetic platform for testing trophectoderm biopsies is called the next generation sequencing, NGS in short, which tests for chromosome numbers and structural rearrangements. For monogenic diseases, polymerase chain reaction, PCR in short, will be applied. For NGS, DNA fragments are created and adapter molecules are bound to the DNA fragments. They are subsequently aligned and compared to human genome database, highlighting the extra or loss of genetic material on certain chromosomes and thereby generating a report. PCR is another genetic test for Pgt. It rapidly makes millions to billions of copies, including complete copies or partial copies of specific DNA samples, thereby allowing scientists to take a very small sample of DNA and to amplify it to a large enough amount to study in detail, thereby identifying embryos with abnormal genetic makeup in a specific area of interest from normal embryos. When we know which embryos are genetically transferable, the patients will undergo frozen embryo transfer. Here we advocate single embryo transfer each time to reduce the risk of multiple pregnancies. However, there are 2 points that we would like to highlight to our patients undergoing Pgt. We should always understand that there may not be any transfer after Pgt if no blastocysts are developed, or if blastocysts are of poor quality, or all the blastocysts are genetically abnormal after the Pgt, and that we cannot disclose the sex of the blastocysts unless medically indicated. We quote less than 5% of misdiagnosis of the Pgt results. These are usually due to allelic dropout, aneuploidy, or undetected recombinations. Also, NGS cannot detect point mutations nor polyploidies like 69XXX. NGS may not detect small chromosomal imbalance less than 20% megabase in the current genetic platform, and there could be problems like mosaicism of the embryos, thereby complicating the condition. When the patient gets pregnant, then we need to talk a little bit about the prenatal diagnosis. For patients who underwent PGT-M for monogenic diseases or PGT-SR for structural rearrangements, conventional prenatal diagnosis is advised to confirm the results after the conception. Ultrasound follow-up will be arranged by the prenatal diagnostic center, which includes chorionic villi sampling or amniocentesis. This is the overall timeline of Ivf Pgt. Patients will report the first day of period, then ovarian stimulation will be carried out using FSH, which on average lasts for around 11 days. When the follicles are big enough on ultrasound, ovulation trigger will be given, and egg collection under transvaginal ultrasound guidance will be performed. This procedure will be done under sedation and local anesthesia. Embryos will be cultured until day 5 to day 6, where a blastocyst will be formed. Trophectoderm biopsy will be taken for genetic analysis. Then embryo will be frozen at blastocyst stage. When the PGT report is available after 2 weeks, frozen embryo transfer will be arranged if there are normal embryos for transferal. So these are the PGT charges in our center, which is also available in your pile of notes. So it's separated into the pre-PGT workup and also the PGT treatment cycle. So we welcome all the questions. You can also always refer to our website, hkuivf.hku.hk, or you can follow our Facebook and also Instagram. Thank you. Should you have any questions, you can reach us at our WhatsApps or our voicemail call.